Okay, it says we're recording. So good. So, hello, Shirley Banks, also known as Food Girl 29. And we're going to be doing a little bit of a wrap on a topic that I did earlier today in my Facebook group on incontinence. And so I thought I would share some of the information with you. So this is going to be a little bit of a synapse version because I had a guest on when we did that live in Instagram and Facebook. But anyway, just going to share some information with you. So if you can look at this, it's hard to see. So the bladder is here. The bladder neck is there and the urethra is there. These are kidneys here, left and right kidneys. Hopefully you still have both of yours. And then your ureter. So basically when we eat or drink anything, right, it goes through our digestive processes and then gets filtered into the blood, and then it gets filtered into the kidneys. And the kidneys actually filter out what's good for the body and what's waste. And then they take that and it goes to the ureter and it goes here into the bladder. So the bladder is kind of like a storage tank. And so this is where a lot of women particularly have problems within the bladder. So we're talking about incontinence today. So you can see here that this is the bladder, this is the bladder neck here, and then the urethra actually extends from there, and that's where the urine is actually released from the body. So we're just gonna make this quick and easy, not too much science based for you, okay? So the bladder is a part of the urinary system, which is what we just looked at, which is composed of the kidneys, the ureter, the bladder neck, and the urethra. The function of the urinary system is to balance the pH, filter the blood, balance fluids and electrolytes, release hormones that controls your blood pressure, and it also has a function in RBC, or red blood cells production, and it controls calcium and phosphorus. And so we talked about the kidneys, they filter the waste and it goes to the ureter that moves those toxins down to the bladder so it can be excreted out of the body. And usually small amounts of urine are filtered down every 15 to 20 seconds. So small amounts, right? So the bladder is hollow. It's a hollow organ and it has 3 layers. And typically the outer layer is like connective tissue, has some blood, lymphocytic vessels, and some nerves. The middle layer is smooth muscle and elastic fibers. That's going to be important for you to know. And the inner layer is epithelium. When the bladder is empty, it has like little folds in there. So if you think of like a fan that's folded together, that's how it is. And then once it's filled, those kind of smooth out to contain the urine. The bladder can stretch to a normal capacity of about 500 to 600 cc's. So if you're thinking in terms of what this water bottle is, this is a 500 cc capacity water bottle. This is typically the amount of fluid that the bladder can hold. So are you going to the bathroom when you're going to you have a urination? Are you peeing out this amount each time, or you're peeing out little small? That may be an indication that you're having some issues with your bladder. Or you may know overall that I'm having leakage, having other things. So we're going to talk about that a little more, okay? So we said the bladder can stretch, and problems, when we start having problems, that's identified as pelvic floor dysfunction. Dysfunction, that means something is not working right. And this can be caused by trauma, can happen during surgery, like if you had a surgical procedure, sometimes accidents can happen and the bladder can be nicked. Sometimes it can happen due to childbirth, and it also can happen if you were sexually assaulted or raped. It can cause damage to the muscles and to the nerves in that area. Also, when you have a weak pelvic floor, or you can have a prolapse of the bladder down into the vaginal vault too as well. Okay, and so bladder issues include incontinence, pubic pain, and most of the time women suffer in silence. They don't talk about this. There's shame associated with it because you got your hair popping, you know, you just got your fingernails done, you got all of this going on, but at the same time you're leaking into your panties or to your pants and you're having accidents, or you're limiting your ability to go out and do public things because you don't know when and where you're going to have to use the bathroom and you don't want to have an accident, right? So many women are suffering in silence. So we're just trying to bring some clarity around that and break some of the shame that's associated with it and let you know that there is some help out there. You don't just have to go and buy pads and walk around, you know, with a diaper on. There is some solutions out there that can help you, okay? So we're gonna break that silence around there today, and we're gonna talk a little bit about this. So there's a couple of different types, and I'll just go over this real quickly. Urge is when I've got that sensation, I've got to go and I've got to go now, right? You can have urge and then you can have frequency, and you can have a mix of them too. Like frequency, like I just went to the bathroom, I got to go again, okay? And you can have a mix of the two where you have urge and frequency at the same time. There's also stress incontinence. This is the most frequent age-related, where, you know, I cough, I pee myself. I laugh, I pee myself, you know. Those are the kind of things that can happen. And this is basically due to like loss of elasticity. Remember we talked about like when you have that urge, that's usually that muscle that's in the middle layer that we talked about. That's usually a dysfunction in that muscle in that area. You can also have overflow, which is you're unable to fully empty your bladder because you maybe have an obstruction there, or there may be nerve damage as well, or it could be some medication. And so sometimes these people are doing catheterizations. They have to take a instrument, a tube, and insert it into the bladder to empty their bladder completely. Sometimes you can have total incontinence, which is you have no storage capacity at all. So remember we said that this bladder here, this area, should be able to hold about 500 to 600 cc's. But because you have an issue of dysfunction in that area, you're not able to hold anything. And this could be because of a spinal cord injury, could be something from childbirth, or you could have a fistula, which is like an opening that's there that shouldn't be there. There's also some things that's functional incontinence. And sometimes this is because there's some cognition things going on. Maybe you're dealing with something with, you know, some mental disturbances, or you have Alzheimer's or dementia or something like that. And so you don't know when that urge to go happens. And so you actually urinate, or even sometimes you have bowel incontinence on yourself. And sometimes it could be because you know you have to go to the bathroom. You feel that urge, that sensation, you're getting that, but you're immobile. Maybe you have an accident or something and you're confined to a wheelchair, or maybe you're bedridden because of your age or whatever, and you can't get up yourself and go to the bathroom. You're relying on somebody else to get you there. And if that is the case, can be still classified under that functional, because somebody else has to take you there. And if they don't take you there, you end up having an accident, okay? So there's a lot of nutrition that can play into there, and I'm not gonna get too deep into that, but I'll just mention a few things. Folic acid, B12, magnesium, selenium, those are things going to be helpful, but we'll get to that in a little bit. What I do want to pull out is vitamin C in your fruits and vegetables, but not too acidic vitamin, because sometimes that can cause some issues with overreactive bladder. So you want to rotate your fruits and vegetables. You know, if you're eating apples this week, then you're eating plums and kiwi. There's a variety of fruits. So it don't always have to be oranges and apples and tangerines. There's so many other fruits. There's grapes, there's plums, there's pears, there's pomegranate. There's so many other fruits that you can actually add in, and definitely vegetables. So vitamin C, what it says, it actually decreases the frequency, the urinary frequency. So vitamin C food, so think about those, okay? But it's best to get it in food and not supplementation. So you don't want to get vitamin C supplements, because that can still actually cause some overreaction, okay? Vitamin D basically has been shown to increase, let me make sure I have my right page here together, yeah. Increase the frequency too as well, okay? So magnesium helps with bladder emptying. So sometimes people go to the bathroom and feel like, I went, but I don't feel like I got it all out. Has that ever happened to you? I'm just asking, okay? So sometimes magnesium is missing in your diet, and magnesium also helps to decrease spasms within the bladder area. Sometimes hormones play a huge role in this. So like basically, you know, as you get older, you see the bladder wall, the elasticity is not there anymore. The bladder wall kind of thins out. Your hormones are shifting all over the place. Usually at that time, women have had several childbirths, or maybe not, but most of the time women have had several children. And so it's a combination of all of these things interacting at one time that you can have the, but what happens as we see is that as estrogen, which is one of our lady hormones, is depleted, that means there's less of that, right? It contributes to frequency and urgency in incontinence, okay? So low estrogen can also cause pressure around the urethra. That's that area down here where the fluid would come out from the bladder neck into to be urinated out into the toilet. Okay, so low estrogen can contribute that. So you want to keep that area strong. You want to keep it stretchy. You don't want to lose its elasticity. And we're going to talk about some things later on that you can do to kind of help promote that. But we just want to get through with the kind of teaching and go through that. So progesterone is another hormone. It relaxes the smooth muscles, and sometimes it can be too much. And so that can increase incontinence, okay? So it depends on what your levels are. Testosterone also plays a role in your sex drive as well as healthy bones, because when you have pelvic floor dysfunction, it not only can cause the incontinence, but it also can play into how you're able to have your sexual fulfillment as well, okay? So let's talk about some testing and some things that you can do. I always encourage everybody to start with a physical. A lot of times what we found that these women, they don't talk to their doctor. They don't even talk to their friends about it because there's such an embarrassment or shame that's associated with it. So they don't talk to anyone about it, right? Talk to your doctor, talk to your healthcare practitioner, your nurse practitioner, your physician assistant, your gynecologist. Talk to somebody that can get you some support and some help. Okay, start with a physical. You also want to get labs done just to make sure that there's nothing else physically going on with you. And in that labs, you want to get hormone levels. You may be on medication that's contributing to the incontinence, because sometimes if you have high blood pressure, you can be on a diuretic, and the diuretic makes you want to go to bathroom more frequently. And sometimes depending on how much you've had to drink and the diuretic, you could have an accident. You could be incontinent. It could be just from the medicine, nothing to do with the muscles or the bladder neck. It could be the medication that's causing that frequency, okay? Diabetes, if you're diabetic, you can have nerve damage to that area as well. And so that can cause some challenges. We talked about also weight issues. If you're overweight, obesity can put some pressure on that area. And alcohol, it can increase, because if you're inebriated, you know you gotta be. So you just, whatever happens, happens, right? So you're gonna have a pelvic exam as well. You wanna talk to your doctor about whether you're having pain with sex or you're having any burning with urination. You wanna be able to really communicate that to them as well. So you can do a pelvic exam that can look, make sure you have, you can talk to them about your sexual health. They may do a rectal exam as well. Another thing you can do is a voiding exam, where you, for 24 hours or 48 hours, you can get something to measure your urine output, measure the amount of water you took in, and measure what you're putting out and how often you had to go, whether you had accidents during that time. So you're doing like a recording of, at 9 o'clock I woke up, I had a cup of tea and a glass of water. I had to rush to the bathroom by 9:15. I had a little bit of leakage before I got there. So whatever happened, you kind of making a diary of what's happening during that day. They will also probably want to get a urine sample from you as well, just to make sure that no infection or any weird thing is going on. So when you have your urine, it should be pale yellow or straw in color. Dark brown could could be dehydrated if your urine is too dark, or you could have a problem with your liver. So you want to make sure you're looking at the color. Is it pink? Is it red? There could be bleeding from the bladder if you're not on your cycle and something's mixed in there. So you want to make note of that. Those are important things to note. If you have foamy urine, it could be too concentrated, or you may be taking in too much protein for your body to break down. If you have cloudy urine, a foul smelling urine, you could have a urinary tract infection. And frequent urinary tract infections is another potential cause of women having issues with incontinence, whether that's frequency or urgency, or the both, okay? So they may also do some other testing depending on what they find in their initial exam. That could include ultrasound. They could do a cystogram, which is basically kind of just an x-ray of that area. They could also do cystoscopy, which is they're going to insert a little tube up the urethra and get a look at the bladder so that they can see the integrity of the bladder, the walls and all that, to see how it's doing. They also may do post-void residuals. When I was in the hospital, I worked as a nurse. I worked ICU, critical care, post-recovery anesthesia, electrophysiology, and the medical floor. And one of the things we would do is that if people had bladder distension, we would get them to go to the bathroom, and then we would do like a little scan to see how much urine was still left in their bladder after they voided. And sometimes we found that people were not emptying completely. Now that could have been a structural thing as well. And we talked about earlier that magnesium was one of the supplements that could help the bladder completely empty. So it may be just a mineral deficiency too as well that's contributing to that. They also can do urodynamic testing, which indicates how the bladder is functioning, how the urethra is functioning with storing and releasing the urine. And it basically is testing the strength of these areas. And they also can help you identify the type of incontinence you're having. If you're not sure, because it can be mixed, you could have frequency, you could have urgency, you could have a mix, you could have a mix. So this is going to help to identify that. So how are we going to treat this? Once we've identified that we've got an issue, we're now talking to our healthcare provider, our practitioner, our nurse practitioner, a nurse, somebody. We're getting help to our GYN. What are the things? There are medications that they can give you. There are injections that they can give you. You can do bladder training, which they teach you how to do bladder training. That's another topic for discussion. There's also surgery, because sometimes we said there's been injury to the area. Sometimes surgery, needs to happen. So talk to your doctor, talk to your urologist or gynecologist. There's also a urogynecologist that specializes in those things, not only just GYN, but also the urology issues as well. I'm going to talk a little bit about some practical things that you can start doing today that might help you set new goals around decreasing the leakage, preventing prolapse, because depending, the bladder can actually prolapse down into the vaginal wall. So these are things that can happen. So we want to prevent those things. Hopefully, we don't want that to happen, right? So there are things that we need to avoid, things that irritate the bladder, like acidic foods, caffeine. Those are things that actually make you go a little bit quicker. And when you talk to your doctor, they can give you a full list of things to avoid about that. But these are things that I would recommend, and these things that I would do for myself, okay? And so whenever I'm talking to you about something, remember, it's education. I'm never telling you what to do for your own particular health. I encourage you to go and talk to your healthcare provider and let them know what's going on with you, and see if there's testing or anything that they can do to help you recover or get better function in this area. So that is the goal, okay? So that's my disclaimer. I'm not your doctor, okay? I am a healthcare professional, but I am not your doctor. So you want to talk to your doctor about things that you're incorporating for your own personal health. We got that? We good? Okay, cool. So you want to get you a good multivitamin and mineral. These are things that I would do for myself. And even though if my diet is pristine, if I'm eating all the vegetables and the right fruit and I'm doing all these things, if my gut health is not good, I'm not absorbing all of the nutrition I need. So I really need a good multivitamin and minerals, because our body goes through a lot of changes and it can burn up the minerals and stuff readily depending on what's going on. So you want to make sure you're giving your body what it needs, and even in the extra, because if your body don't need it, you will pee it out. So, but it doesn't hurt, especially in these COVID street these days. You might want to give yourself a little bit of extra nutrition. You want to make sure that you don't get constipated. You want to avoid pushing out hard stools. You've already pushed out babies. You know, don't be constipated trying to push out, you know, something here. So you want to avoid constipation. You might want to invest in a squatty potty, which, so when you go into the bathroom to have a regular bowel movement, because you can be incontinent of bowel too, as well as bladder. You want to take a kind of a squatty position. So there's things called a squatty potty, where your knees are a little bit elevated over your hips, and you have that kind of squatted position. And that just helps to the ease of the transition of things that come out, so you're not pushing hard to get things out of your body. So squatty potties, that's something you might want to do. Or if you have a small child in the house that has they're potty training, those little stools, you can put that in the bathroom. I want you to get a visual now. You're in your bathroom, you're sitting on your commode, you got the little potty training thing, stool, put your feet up on that. That will elevate your hips, your knees above your hips, and that will put you sort of in a squat position, okay? So that might be an option for you. If you've had issues where you had babies and you've had abdominal separation, or you've got issues with your bladder, you don't want to just jump up out the bed. I'm laying down and I'm just jumping up out of the bed. You want to kind of take your time and log roll out of the bed. So slowly moving out of the bed, you're log rolling so that you're not putting pressure on that abdominal area, okay? You want to avoid bending forward. You want to actually stoop, bend from your knees, and use body mechanics when you're lifting things heavy. Try not to do twisting motions. Try not to carry your baby on your one hip, you know? So those are things that you want to try to avoid, okay? I don't know if you went to charm school. I didn't, but apparently they learn how to walk around with books on their head, and posture is very important, because you see, even when they sit up, I'm elongating my back and I'm taking pressure off of my lower area. Posture is going to be very important. So that might even help too as well, because one of the things that I found, and I'm going to talk about that later, is if you've had issues with like say back injury or something like that, or you've got degenerative joint disease, like at one point in your life you were 5'5", now you're 5'4" or 5'3", those vertebrae in your back and the cartilage in between there, instead of them being this fat, they're now smaller, shrinking. You've lost cartilage in there. So basically it could be that it's causing compression on some nerves that's giving you the sensation that my bladder is full and I needed to go to the bathroom. So you go to the bathroom, but you're not peeing out this whole volume. You know, you only getting out a little bit. You're just getting a little bit out. And you're like, I just went. I feel like I got more. It could be because you're getting stimulation on that nerve root that is not really functional, but it's more pressure from your back area. Okay, so practice posture, okay? If you're like a runner, I know it's a challenge, but you want to like avoid, especially when you're going through this. If you're healed and you're ready, then keep running, keep doing your high impact aerobics. But if you're not, just do a walking program, okay? Skip the high impact aerobics and just start doing walking. Walking increases your muscle tone. It actually helps you, let's see, hold on one second here. It actually strengthens your area there, and it actually helps so that you're not going to the bathroom as often. So when you're having to go poo, you can actually do that very easily without much of a problem. Okay. Another thing that you could do, in something I said I was going to start doing, but you know, with COVID, it shut everything down, so I haven't been able to go in there. But with some research I found when I was writing my first book, that Tai Chi is an exercise that can help you to lift the pelvic muscle and flex the bladder neck. So we talked about the muscles. There are 3 layers in the bladder. There's 3 layers here. And this is the bladder neck here. So it's saying Tai Chi can lift those, the floor of the bladder. So that would definitely help in the prolapse issue. And it will also work with the flex the bladder neck, so tightening of that bladder neck. So it's something I haven't tried yet, but it's something I'm really focusing on, that I am going to try as soon as we're physically able to get back into classes and do that. And it involves kind of slow movement, and it's good for joints and bones too as well. If you can't do those high impact, you know, running, jumping, jogging kind of exercise, this is a good thing for you to incorporate. Let's talk about your Kegels. Most women know how to do Kegel exercises, or at least they have heard of Kegel exercises. So when you do Kegels, how you're doing your Kegels. When I first heard about Kegels, I was just doing them like this rapid motion, Kegel, 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 Kegel. Or you're sitting on the toilet and you're trying to stop the flow of urine. What I learned is that you should never try to stop the flow of urine to learn how to do Kegels. Now, if it's an emergency, you know, you might be trying to do that. But to do your Kegels, what you want to do is want to hold for 5 seconds and then release your Kegel, instead of just doing that Kegel, 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 Kegel. And I heard this illustration, and I can't get her name right now, but she said, I want you to imagine when you're doing your Kegel that there is a piece of lint on the floor, and your vagina is the vacuum cleaner that has to suck that piece of lint up. That's how you want to be able to do your Kegel, okay? So you want to get it in whole and then release, okay? So you're tightening that up. If you have an issue with possibly prolapse, what you want to do is you want to elevate your feet while you're sleeping. Of course, you've already talked to your doctor, you're going through those things, but those are things that kind of help things, hold things in place, okay? Talk to your doctor about getting a referral to physical therapy. I think that's going to be one of the most important things that you can do. You're not sure about that, whether it's covered, you can actually call your insurance company yourself and say, you know, I'm having trouble with this. I really want some issues, my pelvic floor. Is my physical therapy covered? Do I have a out-of-pocket payment? Where is the physical therapy I can go to in my area that's covered under my plan? So you can talk to your doctor as well as you can talk to your insurance carrier, okay? Physical therapy is going to be paramount, because what they can do is they can do biofeedback that lets you know whether you're doing your Kegels correctly or not, okay? Evaluate any back issues you may have. I was telling somebody before that I wanted to get an inversion table, because remember we talked about that loss in height, where at one point I was 5'5", and now I'm 5'3" or 5'4". An inversion table is like, so you get on a table, right? And so this is your feet, and this is your head. So the inversion table is going to take you here so that your feet are here and your head is there. And what that doing is going to relax the spine and take that pressure off of the spine. I'm not saying it's going to grow that cartilage back, but it will take that pressure off of the spine and off those nerves that may be being stimulated, okay? And I think eventually over time, as you optimize your nutrition and your supplements with your vitamin D and some other things that you may be needing to add to that, you may be able to get some of that cartilage growth back. I don't know, talk to your doctor. So you can put in anti-inflammatory foods like turmeric, ginger. We already talked about the fruits. The thing I want to say about the fruits too is this, is that try and optimize your fruit intake and your vegetable intake. I know you may live in certain parts of the country where you don't have different types of, but so I eat collard greens. They're excellent. They're a great source of vitamins, minerals, right? But do I want to eat collard greens every week? Choose other things: turnip, broccoli, string beans, mustard greens, Swiss chard. Do other things. Add in eggplant. Get different types of fruit. We talked about that before. Try to switch things up. Okay, don't always just do spinach. Get some radicchio. Get some. I can't even think of the name of right now. But get some different types of greens that you're rotating, and you're not doing the same ones over and over and over again. Okay. If you find that your areas is a little bit limited in what they can do, cucumbers, your tomatoes, okra, do different vegetables, and those just don't do the same potatoes and corn and collards. You know, we need to rotate. Okay. Potato is not a vegetable anyway. Okay. Some other supplements that you might want to research and talk to your healthcare professional about is horsetail. Found that it helps to reduce spasms that causes leakage in the bladder area. Also corn silk, and it's just like horsetail is spelled just like I'm saying, horsetail. Corn silk. It's an anti-inflammatory, and it can be beneficial too as well for overactive bladder. Capsaicin actually increases capacity in the bladder, and it also reduces pelvic pain. Okay. We talked about magnesium before, I believe, a little bit, but it's important for muscle and nerve function. So sources of magnesium doesn't have to be supplements. You got bananas, almonds, sunflower seeds, broccoli. You want to maximize your vitamin D level. Fish, yogurt, eggs, even cod liver oil is an excellent resource. Okay. This is something I haven't tried. I have experience with essential oils, but I've never used essential oils for this issue. So this is not something I'm familiar with, but there was some research that I looked at, and so I'm just bringing it to your attention. Is it something you might have want to research and talk to somebody about that's skilled in that area? Essential oils. Now, essential oils are therapeutics, so they're not just something that smells nice and little oil. They're therapeutic, so they have a benefit to the body. So you want to make sure you're talking to a healthcare professional when you're using them. One of the oils is cypress, geranium, pumpkin seed oil, and juniper. You always want to use a carrier oil because sometimes they can be irritating to the skin. So you always want to use a carrier oil, and you want to work with somebody who's experienced practitioner when you're using oils. Okay, so we're almost done here. Acupuncture may be beneficial for you. I don't know, but talk to your physical therapist when you get that referral, and see that I did read some materials that say there may be a benefit. I have no experience in that area. I've taken care of hundreds, maybe thousands of people with varying issues, and I haven't really had anybody talk to me about acupuncture benefiting for urinary incontinence, but I'm not ruling it out. So it's something I came across in my reading. So you can actually see if you can get some more information about it. If you practice acupuncture and that's something you're interested in. Okay, and we talked about avoiding constipation. One of the things that if you're eating a lot of fiber and making sure you're getting enough water and movement into, because fiber can be constipating if you're not getting enough water. And sometimes what I see is people just guzzle water after water after water, and it just goes right through it. And you can still be dehydrated if you're doing that. What you want to do, if you think you're low, do about 4 ounces every 30 minutes or so, every 30 to 40 minutes or so, because you want to get the water to get to the cellular level. Okay, that's where you want it to go. Okay, So these were some quick tips and techniques. Get a physical. Talk to your urogynecologist or gynecologist or a personal physician about what's going on with you. Break the shame and have a conversation around that. Optimize your diet and nutrition as much as possible. If you're doing things that are irritating the bladder, coffee, teas, alcohol, excess sugar, if you need to lose weight, those kinds of things. Practice your Kegel exercise, but practice it in a way that's going to be beneficial to you that way, okay? And if you decide to incorporate some of the other things, you want to definitely make sure that you're talking to your healthcare professional. You want to definitely make sure that you're getting an exam, and if it's hormonal, when you go for your physical, ask them if you can have your hormones tested for your estrogen, for your progesterone, for your testosterone, for your FH levels as well too. So anyway, I hope this was helpful. Again, it's Shirley Banks, AKA Food Girl 29. Health and healing. Let's see, stop recording.